Assalamu alaikum wa rahmatullahi wa barakatuh, our dear viewers home. I welcome you all to this program, Health Check. It is a program where we discuss issues concerning health. We have to know it very well that without health, all other things fail. And this implicates that for all things to move in a straight hand, for all things to move appropriately, we have to be very healthy in all aspects of life. My name is Noma Senfuka, and in today's topic of discussion, it is Noma. When you hear the word Noma, you might get perturbed. As I got perturbed in the first run, I was like, what is Noma? What is this exactly? But because we are dealing with health issues, we are going to learn about this disease today. According to the research I made, Noma is a disease that progresses rapidly. And without quick or rapid treatment, within a few days down the road, the patient's condition becomes life-threatening. We are very blessed and delighted to have a medical personnel who is going to be taking us through today's topic of discussion, and that is Noma, in our beloved program, Health Check. Allow me to first introduce her. She is Dr. Hafsa Namkwaya. As usual in our program, that is Health Check, we're always joined by different medical personnel who always try their level best to expound more about the topics of discussion. And in today's topic of discussion, we are going to be joined by Dr. Chwanka Abdul, who will also enlighten us about this disease, Noma. Before I get back to our dear guest I have right now in the studios, let us share with Dr. Abdul Chwanka what are some of the facts about Noma. Let us have him.
Thank you very much, Mrs. Noma Senfuka. You've asked me about the facts about Noma. Noma, the name itself is gotten from the Noma sub-region in the sub-Saharan Africa. And Noma is a disease, is a necrotizing disease. This means death, premature death of cells. And so you have necrotizing, progressive infection that eats up your face, your mouth, towards all the face. And when it comes to Noma, it is a bacterial infection, though we don't know yet which particular bacteria. And then it starts with the mucus areas of your mouth developing ulcers or wounds. Then from there you have necrosis coming up, eating up the tissue and the bones around your mouth. And then this will cause you to develop something that when you look at it, it really looks, it is a wound that eats up your face. So Noma, it's very painful. It is rapid in its progress. It's a rapid progressive, and the person will have difficulty in eating. They will have difficulty in talking. It will be very painful. And looking at this, it is a very bad kind of thing. And when we talk of these bacteria, it's like I've said, they are not they are not. We don't know yet. Most likely, these are very, very simple bacteria that can be easily treated and which can be easily avoided. So that's all about Noma.
Having known some of the facts about Noma, Doctor, what are the causative agents of Noma, or what causes Noma? Let us start from there.
Okay, as we've heard from Dr. Abdul Chwanka, about the facts about Noma. So this disease Noma can also be called cancrum oris. or in a layman's language, we can call it the face of poverty. Yeah, because we find it that most of the times we observe it in areas that are affected with poverty for quite a long time, and it's adversely affecting them for a time. So the causes of Noma are mainly with bacterial infection and malnutrition. Yeah. When someone gets a bacterial infection, their immunity is compromised. And most times we see it happening with those prolonged bacterial infections that go untreated. Yeah. And malnutrition, since when your body is really not having enough nutrients, your immunity is suppressed.
Okay, when the
So-
immunity is very low.
Exactly. So we usually see it with such cases. Yeah. So we also see this Noma progressing out with victims having measles for quite a time that go untreated,
Okay.
and some diseases like meningitis, that's the infection of the brain
Okay.
and the spinal cord. Yeah. We also see this Noma manifesting with people that have poor oral hygiene,
Okay.
since it's affecting the mouth. As you hear, it's cancrum oris, oris meaning the mouth.
All right.
Yeah. So if someone stays for quite a time with a very poor oral hygiene, we usually see it surfacing in such people.
Okay.
Yeah.
Thank you so very much, Doctor, for taking us through the conservative agents of Noma. My dear viewer home, I believe you've gotten a pen and a piece of paper. You can save a friend, a relative, or anyone you're living with in your community. Let us proceed. Having taken us through the causes, who are those people at a risk of being affected by this disease?
Mainly the people that are affected with that disease are people staying in resource-constrained regions or communities where there is no access to nutritious food,
Okay.
no access to clean water, you know. Yeah. We also have a group of people within 2 to 6 years. That is the young age.
Okay.
Yeah. And most times we find it like 90% of the times we find it in children below 5 years, pointing out the 3 years age, whereby we're having the weaning time around the 3 years.
Okay.
Because for the first 2 years of this child, they are receiving breast milk that is quite very nutritious. So cutting it off really strains this child's
Because some of them do not
health.
want to feed on the food and all that because they're
Exactly.
used to breastfeeding.
Exactly. So that alone constrains their immunity if the parent doesn't act fast and take good care of the child. We also have people, adults, though it's rare, adults and adolescents that have immunosuppression. We tend to see it surfacing in such people. Yes.
Thank you so very much. For those that were surprised, what is Noma? What is it exactly all about? We are delving deep and deep. I believe by now you have started learning something about this disease, Noma. For every disease, doctor,
Yeah.
there are signs and symptoms, okay? So for Noma as a disease, are there the main signs and symptoms? And if they're there, can you take us through them so that our dear viewers proceed to learn more and more about this disease?
Yes, as you said earlier on, this disease, Noma, it's a sudden, it happens suddenly,
Okay.
but spreads or progresses very rapidly.
Yeah.
Yeah. So one of the signs of this Noma that actually surfaces in the first stages of this disease is an open ulcer or wound or blister in the mouth. Most times we can differentiate this particular ulcer from these other ulcers that we get from
But
the
then
mouth.
it is the medical personnel that can do that.
Yeah, but of course maybe you may get a time whereby you're having your meal,
Okay.
then maybe you prick your gum, that's different,
Okay.
or you're brushing, because sometimes you find that you're using a hard toothbrush.
True.
and you prick your gum, you will still get a small mild wound. So to differentiate it from this cancrum oris is that this particular wound actually has a foul smell.
Okay.
It has a bad odor that comes out from it, more especially that particular area
That is affected.
That is affected.
Okay.
Yeah. Then we also have swelling, edema, like most especially in the second stage. After the first stage, we have the swelling that happens quite very rapid, you know, and it doesn't even take like a week. It takes just days.
Okay.
Progresses very rapidly every day. Each day that passes, it keeps on increasing. Yeah. We also have facial disfigurement, most especially for the area that is affected. We are seeing that that part is compromised. We are having tissue loss for that particular area. In that, let me say if it's affecting the mouth and there is tissue eaten up for that entire part, even when you're chewing, we can see how your teeth are moving.
Okay.
So it's that bad with disfiguring the person's face.
Meaning that opening it slowly till it gets outwards.
Exactly. It goes outwards. It can also affect the nose, also towards the eye, impairing someone's vision.
Oh.
Yeah. We have also a foul smell, as I told you. We have general body weakness, since it's also affected, caused by a bacterial infection, just like any other bacterial infection in the body. It brings general body weakness and also associated with malnutrition or immunosuppression. Really, your body can't stay that strong.
Okay.
Yes.
Gastro, the main signs and symptoms. My dear viewers home, I believe you're learning something. The program is not doing any bad to you, but rather we are learning. I am learning, and I believe you are as well learning. During programs of health check, we usually interact with our viewers out there, where they ask different questions about a given topic of discussion. Yeah. As you know, we are not all that very informed about the different diseases. And then people use that opportunity, if something has been put on table, to ask quite a number of questions, of which we really give them that opportunity to ask, because we really know we always invite our medical personnel that are having that concrete information to deal with such questions. So there is a question we have that our viewer asked.
Yeah.
Let us have it at this particular time, and then you give us a feedback.
Assalamu alaikum warahmatullahi wabarakatuh. I'm Bazibulu Bala Yusuf, the doctor in the studio. My concern is, I heard that Noma is a contagious disease. Doctor, is this true?
Is Noma a contagious disease? Is it true, doctor? Try to enlighten us about that.
So Noma is not a contagious disease at any point. Yes, because mainly, yes, we have the bacterial infection that gets in,
okay,
but mainly it comes to victims of immunosuppression. If you find yourself, even when you have a bacterial infection, but then your immunity is quite well, you won't be at risk,
okay,
of getting Noma, you know. So it's only victims that are immunosuppressed, that don't have enough nutrients into their bodies, and then it finds that they also have bacterial infections that are thriving within their bodies.
Okay.
So it's not contagious. Yeah.
So people shouldn't fear all that much.
No, you shouldn't. Actually, the fear alone actually threatens the victim's life. Because now, if Allah guides us and we actually notice this disease at a very early stage, let me say at the first stage,
okay,
yeah, we could treat it and actually save this person's life and also the face, because it affects the face very badly. Yeah. Instead, maybe if there is fear, this victim may be isolated, may be stigmatized, you know. Yeah.
Okay. I believe that question has been well answered, our dear viewers home. whoever had such a question in mind, because sometimes one can ask on behalf of others,
Yeah.
because someone may feel inferior to ask, but then also having such a question in the mind. As I've told you that we usually associate with quite a number of our viewers on different aspects concerning health. On this very topic of discussion, Noma as a disease, there is this other common question that is amidst people in the community, whereby they look at Noma as a disease as a result of witchcraft, and some say it is a curse from the child's parents.
Yeah.
Can you dispel the misconception?
Yeah, that's quite common, because even the communities we've tried to associate with, you find that if you to ask the community around, they say that's a curse, that child is cursed. He or she brought bad luck to our community,
Okay.
you know? Yeah, but it's not true.
Oh.
Yeah, this, I think the reason why they attach it to witchcraft or curse is because this disease is very rare. Very rare in that we can approximately get like 20,000 cases worldwide a year. That is quite small.
Okay.
Yeah. So that's, I think, and the rapid spread, it comes sudden, rapidly spreads, and the next thing you know, the person is losing their face. The next thing you know is they are dying.
You may not say that these people talking about the misfortune, the curses, and the witchcraft are wrong, because they are not informed, they are ignorant.
Exactly.
Out of blue, someone having this, rather that facial disformation, it is really weird for someone who has been very normal, but after just a few days down the road, that person looks in another way.
No, most times it's not like they are normal. Because if you to see how these people look, they are really malnourished.
Okay.
You know? Yeah. So that's why it's actually putting them at risk and affecting them. Yeah.
Okay. Thank you so very much, Doctor. That misconception has been removed. It is not as a result of the curse of the child's parents. It is not a misfortune, neither is it witchcraft. Let us proceed. Doctor, for every disease, there are those stages of growth of a particular disease.
Yeah.
Should I assume that Noma also has stages?
Yeah, it does.
And if it really has stages, can you kindly take us through them?
So this particular disease, Noma, has mainly two stages. That is the reversible stage and the irreversible stage. The reversible stage has under it 2 other stages, and the irreversible having 3, making a total of 5.
Okay.
So under the reversible stage, we're having the necrotizing gingivitis. That's where we have the inflammation of the gum and the bleeding of that particular area that is affected. Because most times we see this Noma thriving and affecting maybe one side, one particular area, not like the entire mouth. Yeah. So here we see that the gum is reddened and bleeding and there is pain. That's where our good parents come in and self-medicate.
Yeah, they are very good at that, actually.
Yeah.
Because sometimes they give painkillers to destabilize the pain, and they're like always, in a few days, the condition will have normalized.
Yeah, for the painkillers, I wouldn't say. Maybe if the pain is intense.
Okay.
But then after giving that painkiller, seek out for medical attention to be on a very safer side, because as we said, this disease spreads very rapidly. So you may give a painkiller, yes, the pain will subside, but then you don't know what's happening the following day. You may wake up and your child is having a big swelling at the face, you know. So the earlier you seek.
And then you wonder, how did this come, yet my daughter or son slept when in good shape?
Exactly, yeah. So after the first stage, because most of the times it goes unnoticed.
Okay.
Because even the pain is like, it's quite mild sometimes, depending on someone's immunity. So they don't actually even notice it.
True.
They think maybe it's something minor. So they neglect it.
Okay.
So we lead to the second stage, that is the oedema, where we have the swelling of that particular area. So this swelling usually, it takes doesn't even take a week for this stage to elapse.
So it is just very rapid.
Exactly. And it's these first two stages where we can save this child. We can save their face from disfigurement before tissue loss and necrosis sets in.
Before that opening gets outward.
Exactly. So then we go to the third stage, but this third stage is under the irreversible, where we have the necrosis. This is when we have tissue loss, whereby the blood supply to this particular area that is affected is compromised and cut off, meaning the cells in this area, they
become dead.
Exactly. They are off nutrients. They will just die off.
Okay.
You know? So the patient's tissue starts to slough off. This color starts off.
Okay.
So we are losing it. Yeah. Then we go to the fourth stage, whereby we have the healing and the scarring. Then we also have the sequelae form.
Okay.
Yeah.
Thank you so very much, the medical expert, for taking us through the stages of the disease. Our dear viewer home, let us try to be very vigilant. She has said it very well that our dear parents do not want to see us in pain. Whenever something small catches their attention, the baby is not feeling well, they immediately give a painkiller or any other medication. Please let us try to stop that. Okay, she has said it very well that the pain is always mild. If you have administered anything, let us try always to seek medical attention very fast so that the child gets chance to be treated in the first two stages, because they are the ones that are reversible before. Though we have the stages, you've taken us through them very well. But then for every disease, there is always treatment and prevention on the other hand. Does Noma also has treatment and prevention?
Yeah, it's a treatable disease, but of course at the early stage.
Okay, the earlier the better.
The earlier the better. So most of the treatments that we give for Noma cases, it's antibiotics, because we have an association of bacterial infection around that particular area.
Okay.
So we give antibiotics and maybe a surgical intervention in case the face is already eaten up to remove the affected tissue.
All right.
Yeah. Then under prevention, for those communities that are resource constrained, we should look at extending resources to these people, to these communities, you know, providing nutritious food to them, because mainly it's the malnutrition that is kicking in to risk these people, and the poverty. We look out for that poverty. How are we solving poverty?
Okay,
because
that
we may be
so that they can
providing
get the food rich in the nutrients that the body needs to build the immunity.
Exactly. So we may be providing the food to them, but of course it's quite hard for you to provide that food year after year, year after year. Yes, you know. So I think it would be better to also provide them with skills and resources, and teach them how to work.
All right.
How to enable their families, how to feed them with good, nutritious food.
Okay.
Yeah. We also look at improving access to clean water, because we looked at the fact that poor hygiene also risks people towards Noma. Yeah, so we look out at being in a very clean environment with clean water. Yeah, even extending medical services to these people, whereby you find a community that has only one medical center that is quite small, limited staff, and serving a very big community. You know, yeah, if we could extend these medical services to those deep areas, those remote areas that are affected, it would help, because now if these services are provided, these people would at least be educated about what they need to know. When do you have to rush for medical help? So that even when you have something that has come up, you know, at least I'm safe. I'm just running close, for medical attention.
All right.
Yes.
Thank you so very much, Doctor, for that beautiful elaboration about the treatment and prevention. Our dear viewers, there is something small I've learned. Some people take hygiene for granted,
Yeah.
but then it is something very important that we should stick on. As we come to the conclusion of today's program under our topic of discussion, Noma, what piece of advice do you have to the victims out there and the parents?
Yeah, as a dentist particularly, I would advise our communities to actually have regular visits at the dental office. Because if you're lucky and Allah allows it, that you're going to that visit in the first stage,
True.
you see, you've saved yourself a lot. You've saved yourself death from this disease. You've saved yourself facial disfigurement and the stigmatization from the community.
True.
You know? Yeah. So at least we should minimize or stop self-medication and actually advise our communities on how to feed nutritiously, so that at least we run away from malnutrition, because it has a line of diseases besides Noma that are just behind it. Yeah.
Okay. Thank you so very much for that beautiful advice. I thank you so very much for honoring our invitation, sacrificing your time to share with us this beautiful and educative information. I also thank our dear viewers home who started us the program up to the time of ending it. A lot has been said, but I believe by now you have learned and picked something that is going to save maybe a family member, a friend, a relative, or any community member out there. I am delighted. Thank you so very much, Doctor.
You're welcome.
And if next time we call you, please try to give in your time as you have done it today. I have nothing to add on because time is against me. May the good Lord continue to bless you, keep you very safe as He has done it always. We meet next time. Assalamu alaikum wa rahmatullahi wa barakatuh.